Jason Warrelmann, healthcare leader at UiPath, here at HIMSS 2021. And with me, Amit Bhagat, CEO and founder of Amitech. Before we get started, a little bit about yourself for the audience.
Oh, sure, yeah. My background, I'm a data geek, and I've spent all my time in healthcare, adult life actually. So, yeah, so I'm very excited to be here, and thank you. And actually being at HIMSS 2021, it's amazing because I didn't think it was going to happen.
Yeah, yeah, we didn't either. But I'm glad we're here. You know, a lot of people did not come, but a lot of people did. And we've actually met more people at this HIMSS show this year than I did in 2019 alone.
Wow.
And I think that's because it's more intimate, more centralized, and we were able to plan a little bit better than the mass exodus of people that you normally get at your booth.
Sure.
It is smaller, but you know what? I'm glad we're supporting HIMSS. It is a really good, solid institution. It's always been there for us, and I'm glad I can give back this year.
Yeah, I'm glad to be here, so thank you, yeah.
And with that, of course, Amitech, you're one of our key partners, right? Very niche in healthcare. You're really a thought leader in the space. You've done a lot of innovative things with us, as well as a lot of our customers. And I'm glad you could spend the time, because I really wanted to talk about the future of work and what you're seeing. You had time, walk around the floor. I spent some time in between meetings today, but you got to see the booths, you got to see some virtual, you really got organizations' point of view on what they see as the future of work, which is a big part of this year's message. Sure. So how do you see really the industry changing, and maybe what is different and why they're driving this message of the future of work?
Yeah, and I was pleased to see the be a change agent or something that HIMSS put out, the big messaging. Obviously, COVID really created a platform, a burning platform for healthcare to kind of wake up and say, we're gonna adopt, we're gonna move forward with digital transformation and really make it easy for our patients. So a lot of solutions I saw on that's booths and people that have here are really geared towards how to engage patient, differently with technology, value-based payment models. How can we make it easy and to deploy? A lot of solutions are out there, a lot of innovation people are talking about. And then what that makes me think about, like whenever that was, when meaningful use happened and the push towards EHRs, right? So it was a big, so this is another inflection point, if you will, to digital transformation, to how do you really create a very different experience for our patient and members using technology that has really evolved. Cost of technology has gone down significantly. Tremendous amount of innovation, right? What you guys have done with UiPath, this just the gaps that we had with the big EHRs, in the workflows, in the administrative workflows. Now we have a technology that can just come in and close those gaps and automate things that are very manual, right? And make the workflows a lot more digital, if you will. And I'm excited about that. Really interesting to see how in next 2 to 3 years how this is going to evolve. And I'm hoping that there's going to be rapid adoption of these digital platforms and technologies in most of the healthcare systems, and with providers as well, and payers as well.
Yeah, you said something interesting. Of course, this all rolls up to consumerism, right? I was on a panel with a lot of healthcare leaders, Texas HIMSS chapter, and when we were asked what is the big focus of digital transformation, we all said consumerism. Like, it wasn't, I agree, when you kind of go down the podium, the old, I'm going to sit in a round table and agree with the executive in the room. We all said consumerism as a true fact. And what you're saying is really consumerism, patient engagement, transparency. And it really requires technology. And it's an interesting point that you're saying. I always promote this message of future ready. And I think this is what the future of work really means. It's that for the first time, especially in healthcare, the technology has finally caught up to the vision of the executives and a lot of the federal mandate. It used to be we had a lot of great visions, but the technology was unachievable. And quite frankly, there's a lot of technology we deploy here at UiPath that hospital systems and health systems aren't ready to consume, but they will be. because there's a couple of factors that drive that. It's policy as one, right? Like meaningful use.
Oh, yeah.
And two, it's data. The better data you have, transformation, the aggregation, cleansing, you talk about EMR and the center of truth.
Yeah, I mean, that's a good observation. The way I think about this, and with Amitech, what we have really focused on, first with automation, we started on the administrative expense side of the equation. When you think about, and the $3.8 trillion we spent in healthcare, 75% of that is medical expense, which is really goes into patient care and all sorts of things around that. And then the other 25% is really just the complexity in managing and financial payment system that we have with multiple payers, right? So a lot of that work that gets done in the admin side of the equation is manual, repetitive, that's really been ideal for automation, and that's what we tackled first. All the back office function, finance, HR, revenue cycle. I mean, claims on the payer side, enrollment. I mean, these areas still have a lot of manual things that goes on, and we're talking about if you think about $1 trillion we spent in admin expense, $250 million could be saved on the admin side, right? So that's where we started our journey. 2.5, 3 years ago. But what we are seeing now is, the back office functions are great and they're definitely helping with admin expense. But then the crisis we have at hand now, in terms of nurses, with COVID, so much of, scarcity of resources and all that stuff, right? And so what we are seeing is that, hey, we need to bring automation into these areas. So to give you an idea, like 30% of a nurse work is non-nurse work, which is like really goes into admin work. Now, if we were able to somehow bring that down with automation, it's let's say to 10%.
Yep.
Then the 20% of the new capacity can be used towards patient care, right? So that's where we see the value of automation coming into the front office to really into patient care. Same thing with physicians, right? I mean, they have to do a lot of documentation, coding, not coding really, but yeah, a lot of documentation and admin work, right? How can we get them to take that time back? Maybe spend that time with their family. Most physicians that tell me they do that work at night.
Yeah.
And so this is the place where automation has really helped.
Yeah, and I absolutely agree, and I think that's where that story is, right? Where you're talking about the cost, right? So when I see pointed solutions, that's a cost. If I could save you a 2x, but I got putting 1x of cost back in, that's not a net that most will invest in. That's why I see a lot of these pointed solutions really suffering. I talk to CFOs and I say, listen, we're going to focus on just really utilizing our current applications more. I'm enhancing my EMR. There's a big health system near us that's doing a multi-million-dollar EHR transformation over 3 years. Use the products I have and do more with it. And that's, I think, what you're saying here is when I look at what UiPath brings in automation is a lot of these pointed solutions are actually achievable in the UiPath platform that many already have.
Exactly.
And it's really a new way of thinking. And when I think of future ready, and the new way of work, it's about making sure that that educational layer is there on how to fully utilize the platform you have. And that's what I'm seeing as a big bonus here.
And then you have to also take a step back and kind of think about, like, as you do work, and the way we think about work is that it's the administrative work that's very repetitive and manual, right? That's low variability. It's not very variable, right? But then as you move towards expert work, it starts to become really like oncology or
very
cardio.
semantic-based automation.
Yeah, so it
as a new
starts
term.
to really become complex in the sense that then you think about how humans will interact with these different types of systems that are there, and how do you combine them in a way that's really helpful to maximize human potential, right? Awesome. So you think about human and bots working together.
Yeah.
So a lot of use cases around that, like how can we augment physicians and nurses when they're doing their work with attended bots, right?
Yep.
To be able to say, hey, go and do this for me. Read the chart. Tell me which patient I should go and check on, right? Instead of me like manually looking at the chart. There are a lot of different ways that we can start to think about future of work as human and bots working together, right?
That. Yeah.
So that's where we see the future of work going with all different technologies. And it may be these on-point solution, but then you start to think about voice, recognition or speech, those type of technology. OCR, like what you can read.
All integrated,
so everything starts to come together, right? And UiPath, your platform enables that to happen, right? To be able to go and call an API and go do this and delegate bot to do something else, right? So when you start to bring them together, that's where you create the maximum potential.
I love it. And we're about to go, but I think the key message that you're saying is applications improve data transformation, automation improves human potential.
Oh yeah, I totally
agree. And I
agree
love
with
that mention. I
Yeah.
think that really is the future of work because people are the future of work,
Right.
not our computers.
Absolutely.
Amit, thanks again as always. Glad that you can join us in the show. Your thought leadership and knowledge in the healthcare sector is very important to us, and I'm glad you could share it with the audience today.
Oh yeah, thank you for having me, and I'm glad to be here and look forward to another session maybe next year.
Yeah,
HIMSS
absolutely.
2022.
And from a data geek to another data geek, thank you.
Thank you.
Thank you.